It appears that it's been particularly tough for younger women. Some recent numbers suggest that women aged 18 to 35, a lot of them say they have been dealing with mental health challenges. In fact, a new survey said 44% of respondents either have a diagnosed mental health condition or believe they're living with an undiagnosed mental health condition. That jumps to 2/3 of younger women in Ontario. Why is it so tough on that group in particular? Tough on everyone, but in particular, that group seems to be more affected. Deepy Sur is here, MSW and PhD, CEO of Ontario Association of Social Workers. Deepy, thank you for being here.
Thanks for having me. Good morning.
Are you surprised by the results of this survey, in particular how young women's mental health is being impacted?
Well, I'm certainly very worried. This is a really crucial age group, this 18 to 35, 2/3 of women being living with a mental health condition or having an diagnosed condition. That's concerning, made me sit up and take notice, and this is a really important age group, as we know.
What are we talking about when we say mental health condition? Are we talking about anxiety, sort of that stress? Are we talking about depression or other things?
Well, we're talking about that along with other things. We could be talking about anxiety, isolation, depression, certainly stressors related to violence and post-traumatic stress. We've seen eating disorders and the rise of that. We've seen lots of struggles around finance and low mood and isolation related to caregiver distress as well. It's been very difficult. This age group is one that coincides with a lot of life changes and new responsibilities for women in this age group in particular.
It would be women who are leaving home for the first time, maybe getting married,
right.
Becoming moms, all of that.
That's right. They might be leaving home for the first time or just finishing school even. They're probably thinking about what kind of families they want to start and maybe even taking care of school-age children. Perhaps they're starting to build their careers, and imagine the financial pressures they've experienced in the last few years with the decline of socioeconomic status.
I feel like there is a lot of pressure generally on women in that age. It feels like there's a lot they need to get done over those years when they're thinking about building a career. They're thinking about maybe starting a family as well. And women obviously have sort of a harder timeline on that sometimes than men do, just because of biology and whatnot, and then throw the pandemic in. But is this typically an age group where there is more mental health issue, or do we usually see it in even younger adults or younger teens?
Well, we know it's incredibly important to start thinking about mental health early, as early as school-age children, and so that we can help people have the right skills and connectivity to the right kind of mental health supports, especially where people are all the time. You think about it, women have been generally more vulnerable to an array of things, including discrimination, gender wage gap, hate crimes, rejection in a number of settings. They're facing a lot of judgment. And on top of that, they feel the pressure to be superhuman at times, right, and have those powers. And that's why it's so important that we invest in their care and their mental health support as early as school age and as early as those first encounters with mental health discussions.
Because it's really a way of flipping our thinking, I guess, and instead of, thinking about getting people help once they have been diagnosed or once they're really having issues, thinking more about mental wellness and our preserving our mental health before there are issues, and finding ways for people to sort of self-care and look after themselves and check in, or maybe counseling even, before you're starting to think something's really gone wrong.
That's right. I think that's why it's so important to have help where people are every day, like schools, hospitals, primary care. If you're visiting your family doctor and talking about it for the first time, then you want to know that that doctor has access to a good social worker or mental health provider, long-term care homes. And we saw a lot of caregiver distress and burnout, shelters in the community, working right on the front lines, where people are every day and not necessarily phoning up just a mental health professional when they need them. It's important. This poll serves as a bit of a wake-up call, because we also saw that 60% of people who sought out mental health supports have had some level of frustration trying to navigate a very complex system, and one that can be described as very patchwork sometimes. Mm-hmm. We need folks like social workers to help connect, counsel, and guide people daily.
It would be ideal, but we're not seeing that happening in the schools for the most part. We saw numbers last week that a lot of teenagers do not have access to a psychologist or a guidance counselor, even in some schools, that there is not someone who's kind of in place ready to deal with mental health crises when it happens. I feel like that's something we should absolutely be putting on the top of our priority list.
That's right. There's over 22,000 social workers in Ontario. We're one of the largest providers of mental health counseling and support, alongside a lot of other professionals who are trying to help our young people thrive and succeed for the future. And so many young people don't have access to someone like a social worker who could get them connected in the right place or address some of those early anxiety or sadness or lonely and friendship situations. And for that age group of 18 to 35, that's equally as important, to be able to have someone who can help you navigate. I call that system navigation. Have someone connect you from the right discussion that you're having about mental health and support, and provide counseling and maybe even some treatment, and then get you connected to things in your community close to home that might require some additional support as well.
All right, Deepy Sur, thank you so much for your thoughts today. Appreciate it.
Thanks for having me. Have a great day.